Evening all. I am live. It's 7 o'clock and I am trying to sync everything. So I'm trying to think it with TikTok, but it's asking me to do my Facebook friends. So I don't want to. Oh, here we go. Right, I'm just going to do that. Oh, here's the. Not really sure. Oh, God, it's just showing my true capabilities with the social media platforms, because I've just tried to be like a proper influencer, and I tried to post a picture of the cottage pie I've just put in the oven, but in the panic it just posted, I think I was supposed to put cottage pie ready to go in the oven or something, but it just posted cottage purr or something like that, and I didn't get a chance to finish it. And I don't know, can I edit something on Instagram once I've put it in? I couldn't. Frantically tried to edit it, frantically failed. But you know, what can you do? So I've got a post on Instagram that says cottage purr ready now, but it's supposed to say cottage pie ready to go in the oven. And what I was planning to do is take a photo of it, you know, when I finished at the end. Thought I'd had a bit of you know, a bit of an angle there of the life. Hey ho. So cottage pie's in, says 25 to 30 minutes. So by all means do ask questions if you have any, but I've got a cottage pie that's going to be cooking. Right, okay, I've got some questions here. So I'm going to crack on. If you've got a question, then Jackie, good to see you. How are you? Staunch. Always rely on you, Jackie. I'm going to get cracking because, you know, got a lot on. Can we remove a lipoma using an endoscopic? I think an endoscope, that should say. Can we endoscope? Oh, endoscopic. Yes, that's right. This. Okay, when I first read this question, I thought they were talking about liposuction. We talked about liposuction before, didn't we? So endoscopic. I've not heard of this, but apparently someone does it. And we've had a patient inquire because I think someone does it endoscopically. No, I don't do it endoscopically. No, I don't do it endoscopically. I guess you could, and I guess the benefit of endoscopically is you can make the incision remote from where the lipoma is, so there's no scar over it. So it does. I don't know how you get it out. I guess you'd have to mash it up to get it out. I'm not sure how you get it out. So an endoscope, if you don't know what it is, it's kind of like a telescope, is what they use for keyhole surgery. So if you, for instance, had a lipoma on your head here, you could potentially make an incision, you know, here somewhere, and put an endoscope down and kind of try and get it out. But you'd have to probably sort of mash it up. Or anyway, I don't do it, so you'd probably have to ask the person who does do it, because there is someone who does do it. And sounds interesting. I mean, obviously you wouldn't be able to send it for histology. Well, you would. You'd be able to send the bits, wouldn't you? Sounds like a good concept. To be honest with you, usually the scars are not too bad. And having said that, obviously, if you can make a scar remote from where the lipoma is, then that's going to be better. But yeah, I don't. So can you remove a lipoma endoscopically? Yes. Do I do it? No. But I believe someone does. So if you want it endoscopically, that would be worth looking at the person who does it. I do it by making an incision directly over the lipoma. Well, not necessarily directly over the lipoma. We try to make the incision in the most cosmetically sensitive place, but it's in the location of the lipoma. So it's in the environ of the lipoma. So if there's lipoma on your forehead, it'll be somewhere around it. It might be a little bit high, a little bit lower to try and put it in the best line, but it won't be kind of over here. And this is another point. What is the difference between a cyst and a lipoma? The fact of the matter is sometimes it's difficult to tell. I had a patient the other day who had thought they had a cyst and it was a lipoma, and it can work both ways. So when you're making the incision over it, it doesn't really matter. If you're doing it endoscopically, it does matter. So I'm guessing an endoscopic one would probably need a scan to ensure that it was a lipoma, because if it turned out to be a cyst, then you wouldn't be able to get that out endoscopically, I wouldn't have thought. So the difference is a cyst is a skin lesion, whereas a lipoma is something that's beneath the skin. So a cyst is kind of within the skin. So there's often a punctum. It can be difficult to see, but a little hole connecting it to the skin. So it's kind of connected to the skin. So you can't really move the skin over a cyst. A lipoma is deep to the skin. It can be right underneath the skin, but a lipoma could potentially be at any level, so it can be quite deep lipomas. So that's one issue with lipomas. Certainly on places like the trunk, on the abdomen, they can be quite deep. So unless you can really feel it nicely, sometimes we do want a scan first to delineate what it is, but also to get an idea how deep it is, because they can actually be underneath, within the muscle, intramuscular, or sometimes beneath the muscle, and they can be in different layers. Obviously, the deeper it is, less problem it's going to give you. So a deep lipoma, you're less likely to have symptoms from. But if there is a big one and you want it removed, sometimes we do ask for a scan for that and other reasons. But the difference, clinically speaking, as a doctor, you don't have to worry about it, because if you've got a lump, you just have to go to the doctor and say, I've got a lump. You don't have to really worry whether it's a cyst or a lipoma. I wouldn't worry too much about it, because it doesn't really matter that much. But the difference is that the cyst is kind of attached to the skin, the lipoma is underneath the skin. It can be difficult to tell. And, sometimes, you might think it's one and it turns out to be the other. It doesn't, as I say, it doesn't matter that much, because the treatment is similar. In terms of excision, potentially maybe a slightly smaller scar with a lipoma than a cyst, because you're not so worried about breaching the cyst wall and removing the cyst wall, so you can sort of squeeze it out. But as I say, if they're deep, you might have to make a slightly bigger incision. So 6 2/3. Yeah, so that's how you tell the difference. You try and move the skin over it, but as I say, from a patient point of view, it doesn't matter greatly. How big would my scar be if I had my lipoma removed from my forehead? So this, again, goes back to how deep it is. So if it's kind of just underneath the skin, and again, you can often tell with a clinical examination, but not always. So if it's like right there underneath the skin, you might be able to get it out through a small incision, because you make a small incision, the lipoma is there, and you can actually literally just pop it and squeeze it out, and out it comes. Having said that, they can be deep, and even like on the forehead, we had one the other day which was quite deep. It was right on top of the bone, subgaleal, which is the aponeurosis, kind of the fascia on this forehead. So it wasn't underneath the skin, it was a little bit deeper down. So the deeper down it is, the bigger incision I have to make in order to get down there. So if you make a little incision and have a look for it and it's not immediately there, the incision might have to be enlarged, because you need to delve down deeper. So what I normally say to people is about the diameter of the lesion, and that goes with lipomas and cysts, but always trying to make it shorter than that to get a happy patient. But I think you should be prepared for it to be about the size of the diameter of the lesion. And certainly with lipomas, it's sometimes possible to sort of squeeze it through a smaller incision than that, but it depends on how close to the skin it is. Do we offer osteoma removal? Well, kind of depends where the osteoma is, kind of. So if you have an osteoma around your knee or around a joint or something, we'd probably defer that to the orthopedic surgeons. The place that we see them is on the forehead, bumps on the forehead, which is a little bony bump for an osteoma. I'm using the royal me. I've had a lot of struggles with osteomas. It's always a struggle, and it's always a struggle pretty much uniquely because of the instruments. You need basically a sharp chisel and and a little mallet to take it off. Once you have the right instruments, it's easy. We spent a long time trying to get the instruments at the clinic, struggled with it. Can go to the hospital and do it, but the hospital charge a lot of money if we use their theatres, and so it becomes a little bit sort of cost prohibitive for what the operation is, because the operation is similar in a way to a cyst and what have you, although it's a little bit more involved because you kind of have to sort of chisel this osteoma off. You can do it under a local anesthetic, so you can stay awake while having it done. So it's doable as long as you've got the instruments. And as I say, every time I've done it, it has been a struggle getting the instruments. And if you know, it's always been a struggle. So it is always a bit like if we have a referral of a patient with an osteoma. Well, we had one the other day, and it wasn't an osteoma. The patient thought it was an osteoma, but it wasn't. It wasn't bony hard. So I guess that's the first thing we could examine you to see whether it could just be a cyst or a lipoma. But if it is an osteoma and sort of bony hard and doesn't move at all, then we're into the realms of getting the equipment, and it's a little bit more difficult. And so we take a sharp intake of breath for people who have osteomas. How long does it take for a scar to settle after having a lesion removed? Depends where it is, really. So the face settles well, fortunately, the trunk less well. So the skin is healed in about a week, but I normally say the scar starts to settle at 3 months, and I say that to everybody, but it's a little bit quicker on the face. You know, after a couple of months, you might find that it's kind of fading and settling. Everyone's different, obviously, and older people, maybe it fades a little bit better than younger people. It can be a bit more red in a younger person for longer. Different skin types can be scar a little bit more obviously, but broadly speaking, 2 or 3 months for it to sort of start to fade, start to soften. It can feel a bit hard, and then 6-12 months, I guess, for it to properly settle. And again, the face usually settles really well. It can be hard to see. The trunk, the back, the abdomen, the arms, the legs, they can be a little bit more obvious. So even when they're settled, it can be you can still see a scar. Often on the face, they can be hard to see. So that's just the nature of the anatomy. Those areas don't scar quite so well. But yeah, healed in a week, starts to settle at 2 to 3 months, 6-12 months for it to properly settle. How long does a dressing need to be on the mole for? Okay. Well, my dressing regime is the same, whether it's a mole removal, a tummy tuck, a breast augmentation, a circumferential abdominoplasty, big ops or small ops, it's a week. So broadly speaking, my dressing protocol is a week for all dressings, and people come. Well, you don't have to come back if you've got if you've got dissolvable sutures. You can do it yourself. So a week. Now you've got to ask yourself, what's the dressing doing? Because on the face, I don't use a dressing at all, and basically what the dressing's doing usually is kind of protecting your clothes, because it bleeds a bit. Certainly the first day it bleeds a bit, so you just don't want it bleeding on your clothes, and your shirt sticks to your wound. Wouldn't be great. So it's just acting that sort of barrier there. So after a couple of days, you could potentially not have your dressing, although you may not want clothes and what have you rubbing against the wound while it's healing, because as I say, it takes 5 to 7 days for the skin to heal. So you probably want the skin healed if you're having clothes and what have you around it. So a week is the norm for dressings on the body. But as I say, the face doesn't have the dressing at all, and you can just wash and shower normally. And the reason for the dressing is to, first of all, not to mess up your clothes, and secondly, not to get little sort of fibers from your clothes and what have you into the dressing. So yeah, you don't have to kind of worry about it too much. If it kind of falls off after 4 or 5 days, it might be okay. It might have done its job, but you can always send us a photo and say, look, what's going on. But a week is a standard, just because it's kind of easy. The dressing clinic normally is a week after your op, is kind of the standard regime we have. So I've got to go and get my cottage pie out of the oven, and if I was a proper Instagram person, I would say give me likes and I'll show you a photo of it, wouldn't I? But I'm not, so I'll just try and remember to put a photo on before I, because I'm quite proud of it, to be honest with you. I don't think I made cottage pie before, but I've followed a recipe and yeah, well, I reckon it looks pretty good personally. So TikTok people, Facebook and YouTube people, have a look on Instagram at My Cottage Pie, and any positive feedback greatly received. Any negative feedback, please keep it to yourself. Yeah, that's a wrap. So if you've got any questions, please do message me, call me, write me a letter, you know, whatever. Bilal Aslam wants to co-host. Want to co-host? I'm guessing that's a misclick. It's usually a misclick. No one really wants to co-host, do they? Do they? Do you want to co-host? You can if you want. In fact, you can completely host if you want. I'll go and get my cottage pie out of the oven. It's funny. Comment. Am I getting comments on this? Say hi. I'm getting comments on say hi. Yeah. Yeah, I will say hi to people on TikTok. You bet I will. Keep going. Yeah, okay. Right. Yeah, anyway, enough about me. I suggest you go and go about your business and stop scrolling on your social media, for goodness sake. Get yourself out in the real world. There's a real world out there. I will see you same time, same place next Tuesday. Stop the